We begin tonight with former New Zealander of the Year, Dr. Lisa O'Sullivan, who has threatened to walk away from medicine if our effed up health system doesn't radically change. His self-imposed deadline is just 2 years. In an expletive-laden online post that starts with the words, "The gloves are off," Dr. O'Sullivan writes of his rage at seeing another brown kid die in New Zealand, his shame at being part of a broken health system, and his anger at some of the incompetent officials that work in it. The GP says the 3 recent meningitis deaths in Northland set him off, but his frustration, he says, has been brewing for a long time. Those with the greatest need, he says, get the poorest performing doctors.
I had a 4-year-old Samoan child who I became involved in their care, brought in to see a doctor here in Rotorua, and doctor sent them home. The child was clearly sick, because 2 days later stopped breathing, had to be helicoptered to Auckland Starship. And this is the incompetencies that I can stomach, bad luck, but I can't stomach poor performance, and poor performance to those with the greatest need. So, my challenge is the health system is stuffed, and and I'm not critical of this government only. This is successive governments. Change things, change it up, because as part of it, it's heartbreaking. But to be a user of the health service, it must be demoralising. What
was wrong with that child?
The child had pneumonia,
but nobody picked up on it.
The thing is, there's good. What I'm actually doing at the moment is nurses are very good at diagnosing problems. Sometimes what you get is doctors get in the way because the nurses diagnose this child's problem and see this child sick. The doctor saw the child, sent them home, and 2 days later, respiratory arrest, helicopter. So
what's the deal? Are our doctors incompetent? Is that what you're saying, or what's going on?
Yep. Yes, there are. There are doctors that are incompetent, and I'm always getting a hard time because I'm critical of the profession. But I'd love to see a Minister of Health in 10 years' time saying, how 10 years ago you thought we needed 100% more doctors. Well, I'm proud to say we need 50% less because we're using other work, a larger workforce, that doesn't rely purely on doctors, and actually communities are looking after themselves more. But look, I am very highly critical of the health system and all those that work in it. And look, even those that work in it agree with me. This is a problem. We have inefficiencies and incompetencies that harm people and cost our country money. In terms of the health system, we spend $16 billion a year on health. There is more than enough money in that budget to do the job. You just got to get people out of the way that are content to sit in mediocrity and deliver poor outcomes.
So you say that you are ashamed to be a doctor in such a f***ed up system. Are you really ashamed? And do you think the system is f***ed up?
Oh yeah, absolutely. The system is shattered. The system is shit. And it's frustratingly hard to work in it.
But what you've just described to me sounds like a total wreck. So what do we do? Throw it all out and start again, or what's the solution?
When you ask, what's required, I'd love that you have a Ministry of Innovation and Thought, actually a Ministry of Intelligence that says, where are the things that we could have the greatest gain for the least spend? We can't go out and roll out another $100 billion of income for the country. We've got to figure out how we spend our current GDP smarter. It can be done. It absolutely can be done.
That sounds like a politician speaking, is it, Lance?
Actually, you know what? I spoke to someone this morning and said, your post counts you out of being having any meaningful political career. And a person I have huge regard and respect for, and is very wise counsel. But, the reality is I'd rather not be in politics if you couldn't say things the way they need to be said.
OK, well, let's hear some more plain speaking then. When it comes to meningitis, what needs to be done? So they're only doing a limited vaccination program in Northland. You've got the floor. What would you do?
Oh, OK. So, number one is vaccination is critically important. I've said this for a long time. I'd make compulsory vaccination. I see that it's not compulsory. I think that's just a bad idea. The rights of a citizen go with the responsibility of protecting yourself and others, and the cost cost to our country. So number one, I would be making that a compulsion.
In respect of this vaccination campaign,
Yep.
would you spread it beyond Northland? You say compulsory vaccination, but should kids be getting these jabs outside of Northland?
Well, look, this is an interesting thing. I mean, we've got a bit of an outbreak in Northland, but there's the same types of kids are elsewhere in the country. I mean, that's not, the other things that need to be addressed are the housing, are the issues of poverty, in these communities, and like I say, access to adequate healthcare early. I mean, this is system-wide change. This is deep rot that needs to be, cut out. Now, people say I'm ranting and just over the top, but I mean, like, I would give up my career if it doesn't change.
You're going to leave medicine?
I will leave medicine if this shit doesn't change.
How long are you giving it, Lance?
I reckon a couple of years, no longer than that, Lisa. I mean, every year I renew my annual practicing certificate. I ask why. The only reason I do is because you have to have some stupid letters after your name to say that you can prescribe and all these other things. I'm doing something which is, I believe, will show that actually you don't need super qualified people to do the job I do. It's a massive overstatement to believe that you need a person with a 6-year degree to do some of the things I do.
You're a high-profile individual. You're a former New Zealander of the Year. Have you had a conversation with the Health Minister?
I've texted the Health Minister on a number of times. I've met him. I've asked to meet, never had an opportunity to meet. I mean, to be honest, the last minister wasn't any good. I mean, it's not rocket science. I don't think you have to have... Well, actually, maybe I should shut up. But anyway, I haven't...
No, don't. Keep going.
You're leading me into a trap.
Speak your mind. That's you say the gloves are off, so here I am giving you the opportunity to truly take them off. So you've texted David Clark. You don't think the last health minister was any chop, and David Clark hasn't got back to you.
No,
hasn't offered
correct.
a meeting.
I mean, does it take someone going feral on social media for that to happen? If it does now, it's actually a lame response, to be honest. But I mean, anyway, I'm speaking my mind, because what have I got to lose? Well, all I'm trying to do is help people that I'm sick of seeing being underserved. I mean, what can I lose? A whole lot. But, I'd rather...
How many times have you texted David Clark or contacted him asking for a meeting?
Half a dozen times. I've been in Dunedin 5 times this year. I've been in Wellington. I've text.
Right.
But, I mean,
what about Calvin Davis?
Surely a Minister of Health is busy, and can't get hold of Calvin. Can't get hold of anyone because they're too busy, Lisa. They're running the country.
What about the Prime Minister?
No, look, I'm not probably...
Have you tried to contact the Prime Minister?
I have. But,
right.
I mean, I don't know what every other Joe citizen's chances of getting to the Prime Minister, but mine aren't any good. OK,
so that's 3. Any others that we need to know about from the government that you've contacted and tried to make your opinions known and offer assistance? So David Clark, Jacinda Ardern and Calvin Davis. Any others? You could probably think of every minister that's sitting in Cabinet at the moment. So Shane Jones, did you try him? Yeah. I mean, look, so the point here is, Lisa... No, seriously, did you try Shane Jones? You did? Almost every minister in Cabinet I've reached out to for different things, health-related. The thing is, like many people, misplaced faith in the fact that politicians can actually make a difference. That is former New Zealander of the Year, Dr. Lance O'Sullivan. The Health Minister, David Clark, declined to be interviewed, but issued a statement to Checkpoint saying, I quote, "My office cannot find any record of official meeting requests from Dr. Lance O'Sullivan. I do recall a number of informal approaches from Dr. O'Sullivan, and we have exchanged text messages on occasion. While I am open to meeting with him, those approaches never turned into formal meeting requests." And we'll have more on this story from Lois Williamson Whangarei coming up. We'd also love to hear your feedback on what Dr. O'Sullivan was saying in that interview. You can text us 2101 or you can email us checkpoint@rnz.co.nz.